Historical background of vitamin D. Basically, the vitamin D was discovered due to the disease called rickets. Rickets is from the Old English word ricken, means twist to twist, reflecting the bone deformities. The bills of mortality for London in 1634 were described by the Francis Gilson in 1645. In 17th and 18th century, rickets was increasingly prevalent in Northern Europe. Sir Edward Millenby, British biochemist and nutritionist, in 1919 he proposed that the ricket was caused by the absence of some dietary factor. In 1922 he noticed a substance in the cod liver oil that prevented the rickets in dogs. Elmer McCallum, American biochemist known for his work on the influence of diet on health. In 1922, he noticed the substance in the cod liver oil preventing the rickets was not vitamin A but vitamin D. Mellenby, McCallum, Steenbok, and Hart worked independently. Time magazine called him Dr. Vitamin, McCallum as Dr. Vitamin. Adolf Windus, in 1926, the German researchers Adolf Windus identified the production of vitamin D in the skin upon the exposure to ultraviolet B rays from sunshine. In 1928, the Windus won the Nobel Prize in chemistry for his work on the sterol and relationship between the ultraviolet light and vitamin D production. Harry Steenbok, professor of biochemistry from USA, in 1923 he discovered that exposing the food to the ultraviolet light increased their vitamin D content. It led to fortification of the milk and foods with vitamin D. In 1930s, milk fortification with vitamin D widespread in USA and other countries. Mass production of vitamins. It began in 1930s and expanded during the World War II. In 1950s, mass production of the vitamin D started even in the foods such as milk and flour. Hector DeLoca. Hector DeLoca and his colleagues identified the active form of vitamin D as 1-alpha 25-hydroxy vitamin D3 calcitriol in 1971. So it was discovered in 1922, but the active form was identified in 1971. Michael Holick and Anthony W. Norman, they worked a lot on the vitamin D3 in the last 50 years, and Anthony Norman, a professor of biochemistry at University of California, one of the world's famous expert on vitamin D, died in 2019 at the age of 81 years. As I was discussing that still 2024, we still don't know much about the vitamin D. And so Trinity College Dublin have questioned one size fits all concept about the a role of supplement. So they have advised that it should be individualized supplementation as genetics, skin type, geographic location, individual baseline vitamin D levels can significantly influence on the required supplementation. Oversupplementation might not benefit everyone equally and could be even harmful in some cases. Cancer, immunity, and microbiome regulation. In the animal study, vitamin D enhance the cancer immunity by modulating the promoting the gut bacteria which helps against the cancer cells. So this study opens the door to the potential use of the vitamin D as an adjunct therapy in the cancer immunotherapy. Neurodegenerative diseases, there is emerging evidence suggesting that vitamin D could help against the Alzheimer's disease and might slow the cognitive decline in the older adults.